I'm often part of conversations about working with clients from different cultural backgrounds and identities. Two themes that I often notice are one, assumptions about people from certain groups, and two, therapists spotlighting themselves, focusing on things like their own biases or privileges. Important as these reflections can be, they can often distract from what really matters, understanding the world from your client's perspective. That's why today we're going to have an encore presentation of one of the early and most listened to episodes. My guest and his colleagues developed the Multicultural Orientation Framework, which prioritizes understanding clients' unique needs and perspectives to develop client focused case conceptualizations and treatment plans. But first, if you're new here, I'm your host, Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia. Welcome to Psychotherapy and Applied Psychology, where I dive deep with leading researchers to uncover practical insights, pull back the curtain, and hopefully have a little bit of fun along the way. If you enjoy the show, do me a huge favor and subscribe on your podcast player, or if you're watching on YouTube, hit the like button and subscribe to the channel. It's one of the best ways to keep these conversations going. This episode starts with my guest responding to my question about his graduate training around multicultural psychotherapy. So without further ado, my very special guest, Dr. Jesse Owen.
I'm probably dating myself a little bit here, but um, I came up, I got my master's in 1999 to 2001, got my doctorate, degree in around 2005. And so we were skirting around cultural issues at the time. And the one thing I did appreciate, at least with my master's training, because I was down in Miami, it was impossible to avoid culture. It was all around us. It was right there in our face, and so the nice thing with some of the models that I had in front of me were like Jose Sabatnik's work on family systems work and doing it in a very culturally sensitive and culturally oriented way. When I got to my doctoral program, I had the basic class where each week was one this is how you treat black people, this is how you treat Hispanic
I
people.
had that same class.
Yeah. And it was, I mean, the intention of it was well meaning. And I've known of Daryl Sue's work for decades, and he didn't try to make it just that way, but he wanted to give some justice. And he actually, if you read deeper into the book, he talks about dynamic sizing and this idea that we have to make sure that we understand that this is imperfect level of knowledge, but we got to start somewhere. And I thought that was I didn't get that until way later, because I thought the class was taught in a way that was kind of stereotyping these different groups, and it didn't make any sense. Um, like I'm not sure what a reflection of feelings is that really not useful for certain cultural groups. We don't have that level of knowledge. We just as a field we don't. And so then that's kind of what got me started down this route of how do I think about myself as a therapist of color in this space? What do I really want to convey to folks? And so that's when myself and Karen Tao and others, Karen and I were really kind of at the forefront of creating the multicultural orientation framework. And we started really she actually came up with the word orientation because we wanted to flip the script on competencies, because competencies didn't make any sense to us. And now, granted, we're in a field where competencies movement is you know, it's the thing that we're trying to do. Um, but what is it if you really take that to task? What does it really mean to be multiculturally competent, and how would you ever know it? And I think that's the challenge that we have as a field, is to really think through that's maybe not the right framing. And I think words matter, and I think the frame matters. And so, when Karen and I came up with multicultural orientation, we're like, well, this is just a lens around how people see the world, and we want people to start uh, seeing the world and their practice through a multicultural lens from start to finish. And so, I mean, I can give you more examples, but I'll stop there. But I think that's kind of where my training left me with so many questions, and then Karen and I started just toying around with some of these concepts in this kind of framework, and it just all kind of made sense to us. And when it made sense to both of us, I was like, okay, we got something here. Let's try to study it.
So So okay, so sort of the a couple of pieces to pull out, and then I'm going to ask you to explain what dynamic sizing is because I have no idea. Um, so uh, so the idea of competencies that sort of implies here are the things you need to know. Here are the things you need to be able to do in order to do this kind of work, right? It's sort of like a checklisty kind of a framework,
Yeah.
right? And that where did that fall short for you?
Um, so like in my mind, like one of the things that really fell short to me was like when I started digging into literature, there's really no like I think knowledge is important, right? Like let's start with that basic assumption. But like there's no studies that actually show that if you know more about like any cultural group, you're going to be more effective with them. And so like when you think about that, like it kind of goes back to this idea of like just because you know a lot of stuff doesn't mean you're good at doing it in the real like in the therapy space. I mean, I think the closest thing along the competency route um, that we got behind was the awareness piece. So knowledge, skills, and awareness. Like the skills, I'm not even sure what they mean by skills because they don't really define it that all that well. Um, but the awareness piece makes a lot of sense to me. I mean, having more awareness of yourself, your blind spots, all that stuff. Like that's good stuff. That makes sense. How we operationalize that and understand it, different story. But yeah, it's so that's where competencies got lost on me. Where I'm like, there's really no great evidence that this matters. And if you actually look at some of the measures that we use to measure competencies, they're either therapist self-report, which I'm not sure how useful that is, or it's client reported. And one of the scales that we took to task and where we started down this route on measurement was one of these observer report measures that got converted to a client report measure, which made no sense in the conversion. And so, like items like my therapist used a variety of verbal and nonverbal interventions. I'm like, is there another kind? Like, what else are you measuring if it's not verbal or nonverbal? Like, how would you, as a client, I was thinking, like, how would you even assess that?
Right.
Or like, my therapist offered systematic interventions. Like, maybe, um, but not likely, right? Like, it's not likely that therapists are doing systematic interventions for every single client. So, anyways, so these kind of measures got me confused, and I was like, as a therapist, if I got that feedback, like, oh, I'm not doing well because I didn't offer systematic interventions, but it wasn't even called for. Like, how would I understand myself as a therapist? So we started down the route of like, what are the actual? And this is where the three pillars of MCO came into light. Was like, what is it that we actually want people to do from a process standpoint in therapy? And so, culture humility. When we got paired up with Josh and Josh Hook and Donnie Davis, like we started in on something that was kind of foundational to the MCO model, which was cultural humility as a way of being. Like we already was talking about this, but like the cultural humility language actually worked out really well um, because it really spoke to what we were hitting at from the onset. And then cultural opportunities gave the what, right? Like what should you do?
So let's so since you're doing it, let me just sort of put a header on it so that way people because what you're doing because I think it's important and I want folks to be able to get what you're saying, which is right now you're describing there are these sort of three facets, three pillars, three aspects of the multicultural orientation.
Yeah, totally.
So yeah, humility, opportunities, and comfort.
Yeah,
So sorry I interrupted you, but I just wanted to bookend, just sort of make sure that folks knew that because this is because this sort of explanation is going to be the majority of the rest of our conversation is going to come from this explanation of these three constructs right here.
yeah, for sure. And so cultural humility for us was the sense of like curiosity, not superiority, this kind of like um, non-assuming lens, but also knowing that you know something, right? So like it's not saying that you know absolutely nothing about culture, but it's about I don't understand maybe what you have gone through based on your own identities, right? So taking a step back and even like, hey, even if you identify with this culture, like you have the same identities, you still don't know what it looks like to walk through the days of that person's life. And so having that sense of humility and connection and this kind of other orientedness of really being present for that person was a strong piece for us, because like that's in essence like what we were saying with the MCO framework was it's a way of being. And what I mean by that, if you ever read Carl Rogers' book on way of being, it was that was a big influence to me for this framework, because what he was saying, I mean, like he was breaking things out for his different principles of change in humanistic therapy, but like what he was really saying is like people, if you get people and people get you, you will know it on a deeper level, right? Where somebody really kind of understands you and really understands what you've gone through, because you're there in a way where you're truly listening, you're truly connected. And that's what we wanted to convey. And cultural humility language and that sense uh, of being was really part of that. But at that point, we were like, when we came out with the three pillars, we actually started with cultural opportunities, um, and because cultural opportunities were the thing that like people were missing. And what we find in our research, in part, is cultural opportunities are those things that like we're training people in programs typically to look for symptoms, to look for distress, to look for pathology, and we're not necessarily framing that through a cultural lens. Now, some programs do better than others, and some supervisors do better than others on framing that. But right, like if you just think about like let's take depression for example. We train people to look for signs of like loss of pleasure, sadness, changes in appetite, blah blah blah. Um, but what we need to be doing is to say, how does depression show up differently based on gender ideology, based on racial ideology, based on political ideology? Like, how does this show up differently? Because depression isn't depression without the person. And I think that's the keys of like really understanding how a cultural oriented lens can really help us shape the ways in which we engage. It's not just diagnosing depression, it's understanding what depression means for this person with this identity, with this lived experience. And I think that's the piece that we need to get back to, uh, or get to. I'm not sure if back to is the right word, but get to at least.
And then do you want to just real quickly, do you want to hit on comfort?
Yeah. So cultural comfort to us was the intangible, right? So the things that happen in those conversations that you could probably pick up. I mean, it as a person, and so like when you're in that cultural conversation, are you feeling some level of distress? Are you feeling some level of ease with the conversation? And people on the opposite side, we knew that like people pick up on this. Like if you ever had a cultural conversation with somebody and they're like, well, let's not talk about that, or like, hey, this is a little bit dicey, like you can kind of get that sense even if they don't say those words. And that's what we wanted to pick up on, because it's that level of like intangibleness that happens in conversations. For I mean, it can be cultural or not, but like it happens all the time, and that's what we wanted to pick up on, that kind of more somatic level. That we have the observational stuff with the opportunities, we have the way of being with cultural humility, and then we have some sense of like emotionally how you doing. And at one time we talked about, some people have used the word like cultural countertransference and terms like that. And I mean that's in the same ballpark. If you read much the most recent literature on countertransference, they either call it reactions or countertransference. So it's moved a little bit even outside of the psychodynamic sense. But we wanted to keep it kind of more theoretical, because we really wanted this MCO framework to be able to be like applicable across different treatment modalities, and that's why it's not a theory; it's a framework. Um, so we're not trying to replace CBT or psychodynamic theory. We're trying to enhance it, and that's kind of our focus.
Well, I think it's interesting because I didn't realize that the opportunities, cultural opportunities, is what came up first for you all. And I think so. So cultural opportunities, the way I think about it is like just either when a client says something. So client talks about something related to, in my family, or at my church, or I don't think that men should, or whatever, right? That you sort of see that and say, like, you do like a follow-up. I mean, this is overly specific, but you do a follow-up with the client to say, like, oh, that's interesting, could you? And so you sort of just create an opportunity, or they created that opportunity, and you sort of seize it to see, like, is there a there? Is there something worth pursuing here? And then you let the client, with your own clinical experience, guide that, because it's possible, like, this could be tremendously important for them right now, or not at all important. And the important thing that you do as a therapist is you follow up on it to see where it's going, or if there's a there.
Yeah, and you're exactly right. Like it's that, following the client, following kind of like what they're laying down, and really exploring, like, what does that mean, right? So like there could be some true values and beliefs connected to whatever identity that they have that will get you nowhere in therapy if you keep butting up against it, or you can work with it, right? Like go with where the client's at. The other piece that drove the cultural opportunities was how do you start these conversations, right? So like how do you create them, not just follow them, right? And so when we were toying around with different terminology, a lot of people use the word like culturally responsive therapy, and we can part words and all this stuff, but like in my mind, it's not about just being responsive. It's about being oriented, that you're hearing everything through a cultural lens, right? So you're hearing this story, even if the client doesn't want to get into the weeds on their cultural identities. You have to know that they're living it, right? Like you have to know that this is influencing their life in some way, shape, or form. And so like they may not see like the forest from the trees, right? Like I had this client who he session one, he was like, don't get me to cry. I'm not a crier. Right. So like, and he was coming from a pretty traditional masculine lens of being, kind of self-reliant, being tough. I can work through this. And like session six, he started to cry. I was like, how you feeling right now? Cause I remember you mentioned that you don't want to be a crier, and help me understand. He's like, I need this now, and I feel safe here. And so like, different times, different places, you have to like understand where this stuff is coming from and kind of work within it, and so be supportive and understand that. But like if you don't see that through a cultural lens, I could see a therapist pushing this guy to cry, which was not my intention at all. I was following him when where he was at that time and where he needed to be. And so like that kind of stuff, it's important to understand. Like that's um, informing my way of interacting with him without even naming the masculine script that he was following. Right. So like it can inform your conceptualization. It can inform your interventions. But if you're not thinking of it in that way, you might do something that's just completely consistent with your theoretic orientation, which is fine to a point, right?
Right. So what I'm hearing you say is, like, you're taking that information that you have about the client, in this case, his culture, identity, values, perception, and sort of bringing that into your conceptualization of the client, and then using that to feed your thinking. And then, so when that came up a half dozen sessions later, you're able to sort of bring that to, right, sort of bring that to him and see what's there.
Absolutely. And validate, like, we all experience these emotions, right? Like, do something that's encouraging, right? Because that's what he needed at that time. But yeah, it's exactly what you're saying. Those are the moments, right? Like, but if you're not thinking through that lens, and let's say if you're like an EFT therapist, like you might be digging into emotions that he's not ready for quite yet, right? Or, well, no, like I could see it going a lot of different directions, if not considering his masculine scripts that he was embodying.
Right. And so what, I mean, again, what I'm hearing you say is, if you're an EFT therapist, and in the first session when he said that, and you took it and integrated that would influence, that you would sort of, pull back on the reins, perhaps, of sort of some of your emotional experiencing or whatever with the client, because you're aware of that. So, like, just again, it's not because this is a a theoretical or trans theoretical approach that you don't have to stop being a emotion focused therapist, but you should still take that into your conceptualization of the client, and then of course your work with the client in order to be more effective, obviously.
Absolutely. Yeah. 100%.
So the humility piece, which if memory serves, in some of your writing and your colleagues, that you all have sort of said this is the foundational aspect of multicultural orientation framework. That, like, just I think to hit that, the way that I think about that is, yes, I'm the expert on mental health stuff and psychology stuff and psychotherapy stuff, but when it comes to my client's experience of life, of their culture, their identity, how they see the world, that I should let them be the expert on that, and to learn from them, to not make assumptions, and to sort of, when I give how can I say this, like, yeah, to be willing to sort of value my client's experience of things, even if it's inconsistent with my expectations or perceptions of how things could, should, would be.
Yeah, absolutely. And I mean, I think it's interesting to see like who gravitates to what pole pole in the NCO framework. I mean, I think the culture of humility really does provide a glue to everything in terms of like, yeah, this is how, like, take a step back. And so like one of the things that influenced me a lot and why humility was a really big pillar here was I started my academic work in clinical judgment research. And reading this research, I mean, it's what you would assume, right? Like, it's just human nature. Um, like, people make quick judgments about a lot of things, and as therapists, we have to make quick judgments, right? We don't have a ton of time to spend with any one client. But the scary thing about some of this research, especially the early research, people make clinical judgments within 1 minute of meeting somebody, and then they do what we do as humans, which is try to confirm what we know, and don't look at disconfirmatory information all that well. And that's where cultural humility comes in nicely, is that it should be that backstop to those kind of judgments, that we should say, what what else could this be? What am I not seeing here? What's the cultural experience of this person? How is this helpful in our understanding? And so, like, to me, like, that was a great way of like suggesting to therapists, you're not the expert. You don't need to be the expert, and you don't need the client to teach you anything, but you need to be a collaborator in this process and go down this journey of true curiosity and learning about this human being that's sitting in front of you, and see where that gets you. And I think most therapists think they're doing this, and I think a lot of therapists are doing it in a way. And there's times when, like, we're not doing this, right? And we have all been there. Like, we've all been on autopilot some sessions. We've all been not fully present. We know that. Like, that's just the human experience. And yet, let's think about what can we remind therapists to be, and check in with themselves about how are they really orienting themselves to other people. And that's where cultural humility, I think, is a great reminder of all that.
Mm-hmm. So, okay, so now let's hit on the comfort thing. And this is the one I sort of struggle with the most of the three. The first two seem like, oh, this is great. The comfort thing I struggle with a little bit more. Now, before I say this, I should say that, I'm in the bag when it comes to MCO. Like, I'm like totally in. And I don't know, for transparency, like, me and one of my students have done some work on it. We just had a paper published, like,
Nice.
my student, Olivia Fisher, I should give her a shout out, that she has a couple more papers that are about ready to be out as well. So I'm totally in the bag. So this my little pushback here is taken with taken within that context. Um, so with the cultural comfort thing, one of the things I struggle with is that we would expect that therapists will be, when they're working with folks from different cultures of their own, whatever that means, and who have different values and belief systems, that they're going to be a little uncomfortable talking about some of these things.
Yeah.
But we still want to encourage them to have those conversations and to sort of push themselves in spite of and while experiencing that discomfort. So this is where I struggle a little bit, which is it, are we sort of saying it's bad to feel uncomfortable, or if you're feeling uncomfortable, that should be a red light not to go there because displaying discomfort is a bad thing for your client? So I'm curious your thoughts about that.
No, that's a good question. And honestly, like, um, what we consider cultural discomfort, if you will, the other side of that coin, is really more of a sense of a signal, right? Like all of this is just a signal. And so when you get down to the literature on information avoidance, so I'll circle back around how this relates to comfort. Uh, uh, Information avoidance is this concept that's been around for decades. Um, but basically, it's the ability to avoid information that makes you feel uncomfortable. And so one of the classic studies is they did the study on how many people came back after they got tested for HIV, how many people came back to get the results. And you would think like the initial buy-in to even go to get tested would suggest that all of these folks are going to come back. But almost a half didn't come back to get the results, right? Because it's uncomfortable to know the reality of certain things. And so the interesting thing about cultural comfort and how this loops back to information avoidance is that when you're in a privileged position, which I would suggest that most therapists are, by virtue of their role, maybe not societally based on their identities, but like at least in their role, you have the privilege of not going down the cultural angle if you don't want to. You have the choice to not start that conversation, to not follow that conversation. You can change topics. And unless the client is really insistent on going down that angle, you can avoid it. And so that's the real issue for us is like, how do you lean into that? And it might not be lean into it in that session. Like if you're really uncomfortable about it, maybe get some consultation, get it, if you're a trainee, go to your supervisor and figure out like, how can you work this in? Because it's meaningful information, right? Like it's something about the session or something about the person or something about the dynamic between you and the client that's meaningful. And so use that as a way of understanding your client deeper, understanding the therapeutic process deeper. Um, and it can relate to a lot of different things. It really could be the cultural angle that you don't feel comfortable with. It could be your own personal beliefs and how that's coming into the room. And so, like, how do you use immediacy? How do you use these other techniques um, to help bring that to light and help you navigate that sense of discomfort? And I would say some level of discomfort is probably good, right? It's giving you a sense that like, okay, something's not fully aligning here, something's not quite going on. And what we know with like the alliance rupture repair literature, when there's those tensions, not even like a full rupture, but like when there's those tensions in the relationship, that's where you need to process things, and that's what's helpful. And now to put it into a cultural lens is the more challenging piece, I think, for a lot of therapists, where they feel like they can't go there or they shouldn't go there. Um, and what we see in some of our research is that like things around political affiliations, religious affiliations, some of these like deeper held beliefs are harder to talk about. And yet we should, right? Because those are important.
So this is um, one of the classes I teach, and we have several sections of it here, is like a basic helping skills course for we have a variety of students in there. So sometimes they're sort of advanced undergrads, sometimes they're kind of in between, and sometimes they're like first year or whatever, early grad students, not in our program, but in like, we have social work students in there, we have genetic counseling students in there. And so this is something that comes up in there that they're often concerned about, which is, so what do I do if my client has certain, let's say, values? Because I think in a way that's kind of um, a more challenging construct than beliefs, even though obviously they overlap. But when they have values that are antagonistic to my own.
Yeah.
So how do you think about that within the MCO?
Well, I think that's where life happens. Um, and I think for a lot of us, like, it's easy to avoid those types of dilemmas, but like what's missing in that is a true conversation. And I feel like in some ways, maybe it's the politics here in the US or something along these lines of around like cancel culture. And if I say the wrong thing, I'm going to get fired, like these types of like really egregious things. But really, if you really boil it down, like if you really want to understand somebody's values, um, that's great. That's where like joining really happens. And so to me, like you don't have to agree with the client. Like, there's beliefs all around that I don't agree with, but it's really interesting to know how you got there and what life lessons, who's attached to that story that gave you that value, right? And that's the history that like help you understand who you're working with, right? Because like if you think about like, and this is maybe more psychodynamic or systems based way of thinking, but like if you think about the values that we hold, they came from something, and typically they came from an experience with people. And so who are those people, and what did they experience, right? And so like I think about it in that sense of a lens of like there's a story to this. It's not just I don't support, you know, abortion rights or whatever. Like it's not just that, but there's a value and a belief and a whole system of people that are connected to that. And that's who you're working with. It's not just the person in front of you. And so from an MCO framework, like get to know that family, get to know that value system and who's in that value system. And is it really important for you to combat it, as a therapist? I think that's a different question, but like, um, yeah. So that that's the storyline. And I think some people say like, well, it's too hard for me to hear stories when it's not consistent with my values because I have this identity, blah blah blah. And I frequently think I'm like, well, that's a very me first kind of position. And as a therapist and like deepening your way of understanding others, you're going to have some difficult conversations with people who don't believe the way you do. And it's a valuable way to do this. And part of that's from my own upbringing, but like I think some of it's just my way of thinking about the world. So I don't know.
So one of the things I'm taking away from what you're saying is when that when a person when you're sort of hearing a value that you or sort of is inconsistent with your own, take that as an opportunity to explore, to understand, to see what's going on there, and like that's where that's sort of a useful and therapeutic intuition to have.
Yes, absolutely.
Okay, so even in this conversation, one of the things that students have difficulty wrapping their head around with multicultural orientation is like, what's the thing that we're talking about? Like when we're talking about culture, and like in your writing, sometimes culture and identity get used, um, kind of interchangeable. Well, in this conversation, it's been used interchangeably in some ways. So how do you think about that? Like, what is when you're thinking about applying, let's just say humility, for example, like what is the thing that we're applying humility to?
Yeah, so to me, it's and this is where like intersectionality comes into play, where you really have to think about somebody's cultural identities, whatever's salient to them, not what you think is salient, um, and what values and beliefs are associated with those identities. And so when you think about culture in that lens, there could be an identity that's important, sure, but then there's associated values and beliefs that go with that identity, right, for that person. And it's going to vary from person to person. The intersectionality of identities, it's key to understand. And, when we first started down this route of studying different cultural things in psychotherapy, we we did what most people do. You know, check the box if you're white African American. Check the box based on gender identity, blah blah blah, and all down. And those demographics are fine, but when we started to really study this in a more meaningful way, we just had an open-ended uh, field that said, "What's your most salient identity, and how important is it to you?" And like we had list your top three or more identities and how salient are they to you, and they didn't always match up to what we would assume. So, for instance, we did a study here in the Denver jails, and one of the most salient identities for a sizable number of clients was their gang affiliation. And so that's what was important to them. And so, like, to understand what that gang affiliation means is probably something different than what we would normally put down on a demographic form, right? Like, and so um, I also think about like, I had this client. It was first session. I was in my postdoc, and we don't get to choose our clients on our postdoc. We just get people assigned to you. And my name being Jesse, it could be a girl, it could be a boy, it could be somebody else. Um, and so this client walks in, and she goes, I really want to talk to a woman. And so like my identity as a man influenced like her salient identity as a woman at that moment, right? But if I was a woman, I bet she would be just fine going on with the session, right? And so like even the saliency of identity can matter on who's sitting across from you, and like what is really truly important to you at that moment. um, and so like and I think that's an important lesson to learn from most therapists, is to be like, think about yourself. How you're showing up influences how this therapy is going to go and this therapeutic process. And so whatever cultural values and identities you hold, make sure you know them and understand them, and make sure you're checking in to make sure that it's working for the client, right? Like how these are gelling or not gelling, because there's a lot of assumptions that go on, and
So
that
so so that so just sort of see if I have this right. When you think about it in terms of what's important, what's salient for this client regarding their identities, their values, those sorts of things. Those are sort of, I sort of think about like identities and values in some ways as like a manifestation of culture. Um, because I don't know about you, but when I think about like culture, I sort of think about this nebulous background thing that we all experience, right? And is like nearly impossible to define. And I think about when I'm with my client that's, what their identity and values and similar sorts of, I mean, you could even bring in personality and that sort of thing, as like the manifestation of their culture to some extent. I don't know. So I guess that it's the salient identity, values, and related things. That's the thing that you're saying is that's the thing that you're focusing on with the client.
absolutely. And we get some critiques on this issue, but to me, like the reason why this is we focused it mainly on psychotherapy and now kind of onto supervision. But like the key piece for us is like everybody has some cultural values, right? And so like that's what's salient. Even if you're dealing with somebody who's from like a majority culture, who has a lot of privileges, those identities are still important, right? Because it speaks to who the person is. And this is kind of where like some of my training on personality, and really focusing deep dives on personality kind of influenced this space. Is like the person sitting across from you who who's privileged, at all rights, might have it easier when they walk out the door, sure, but they still want to be heard. They still want to be valued. They're still in distress for whatever reason, and how you connect with that person is going to be important, right? And so like there's pieces of that where like, yeah, it's going to look different for based on the client, but like in that moment, that person's cultural identities and values and beliefs are really important to them. And so, how do you dive into understanding that?
Right. And I think what you're hitting on is a really useful example. So it doesn't have to be sort of I don't know what the right language here would be, but sort of a minoritized facet of that client's culture. That it could be, that it certainly could be, but it doesn't have to be. And so to sort of key on whatever those for example, those identity sort of facets are, what they're saying, is important to me, or, I need to be this or I should be that. That's the things. Those are the things to key on, even if it has nothing to do with anything related to a minority culture. You probably have better language for this than I do.
No, you're absolutely right. Like, and I think that's the key. Like, you know, in our society as a field, should we be helping minoritized clients navigate this world? Yes, absolutely. And I think we can and we should. And this model or this framework can help do that. And it doesn't mean that you just turn this off if the person sitting in front of you is from a more privileged background, right?
Yeah, totally. Yeah, and I think this is one of those things that I think that when I teach it, I struggle to get across um, to students. And I don't know if that's different in 2024 or 2023 than it would have been if we were teaching this in 2015. Um, but that to help students see, like, it doesn't just have to be about how we usually talk about culture in the media or something like that. That
Right.
it's really keying on what's important to this client, what's in this client's background and experience that's influencing them today as it relates to whatever their actual concern is. Because my client might be, their their identity as an African American woman could be relating to the stress and experience they're having at work or at school, which they're coming in with, which is what we're talking. But it could also have nothing to do with what we're talking about, and to sort of, so it does matter in this context, because I'm here to help them with what they came in for, um, to make sure that it relates.
Absolutely. That's 100%. And I mean, all this stuff is going to influence the clients, like what's happening in the larger society for sure. And this is partly the reason why we differentiated our framework from more social justice frameworks. And there's a lot of really good social justice frameworks out there. I love a lot of them. I've my top 10 list for sure. And they're trying to, you know, Suzette Spite said this really eloquently. Like, social justice is about creating social change, and it could, helping a client, navigate the world better, create social change, sure. But if you really dig deep into the social justice frameworks, they're talking about larger systemic changes in society or groups or different kinds of facets that typically, so like, most psychotherapy sessions are not really focused on. And so, like, do those models if that's what you want to do social change on, um, because they're great, they're fantastic, I love them. And understand where this kind of MCO framework kind of fits into the psychotherapy space, because it was intended to be more of a process based model, or framework at least, for psychotherapy when we first started, not to try to create social change.
So I think this is important, but I hadn't really thought about it in this way. So this is actually very helpful for me for thinking about it and sort of separating sort of a social justice framework from the work that you all are doing, which I think of as more as, how can I optimally help this person who is sitting in front of me right now?
Yes, 100%. That's what we were focused on, and what we continue to be focused on, mainly because I think, I think some therapists say, oh, well, I'm doing I'm doing MCO work, so therefore I'm doing social justice. And I think that conflation is not accurate. I just don't think they're the same. I think social justice frameworks are a larger calling to, like, change environmental, political systems that are unjust and continue to be unjust.
So I hesitate to ask this question, but since you're here, I feel like I have to. And if it's no good, we can just delete it. Um, but I'm curious about, because I'm sure you've thought about this a lot in a lot more of a sophisticated way than I have, applying social justice frameworks in psychotherapy.
Yeah, there's been some writing on it. I'm just not convinced that. I don't know what would be, if it's applicable. Sure, right? Like, so if a client is facing social injustice, maybe in their workspace, maybe in society at large, like, sure. maybe you can work with the client to do some of that change. But my experience has been most clients aren't coming into therapy to be like, help me change society. I want this law changed. And how can you help me get there? That's not been my experience for most of my clients. Most of it's relationship distress, depression, anxiety, like, I mean, some psychosis here and there. Like, that's been my experience in my practice, which has been not not devoid of the societal pieces, but they're not asking for me to do something larger, kind of more systematic change. And so it could be that you get inspired by a client to change, try to help child protective services do things differently, or help this system do things differently. That's great. If that's your personal calling, do it. But I doubt most clients are like, yeah, let's do this together. That's not been my experience.
So, all right, I'm going to ask you one more question, just because, frankly, this is very much selfish, just because it's like, oh, I've asked somebody who's really thought about this stuff a lot that I can pick his brain on. And again, this is again going to be maybe a little pushing it. So if this doesn't turn out well, we can always delete it. But I guess I'm curious about your thoughts, because our field, so you and I share a field of counseling psychology.
Mm-hmm.
That counseling psychology has become increasingly, over the years. I mean, it always has, but has been sort of increasingly social justice focused. And I would say that there's been some writing on this, that it's moved from less counseling or psychotherapy focused to more social justice focused. I'm curious about your sort of high level thoughts about that.
Um, I mean, I think whatever people want to do, and whatever they want to focus on, like, that's great. Like, I mean, I think counseling psychology has so many different branches underneath it, and different kind of specialty pieces that, um, it's a big tent. So there's a lot of space for a lot of people. And I think that's a good thing. I think the focus on social justice and more multicultural oriented type of training, I think, is also a great piece. Um, I think we need to not lose sight of who we're training too, right? So 90+% of our graduates from doctoral programs are going to be seeing patients. They're going to be supervising folks, most likely. They're going to be seeing patients in some capacity. And so, what we need to also remember is what pays the bills. In academia, I'm sitting here in a color coded bookshelf, and it's really nice. And it's nice that I have this job where I can spend the time just thinking about these topics. But at the end of the day, if I wasn't sitting in this room, I would have to see patients to make a living. And I think there's a reality to that we must not forget as trainers, that, like, yes, we can train people in social justice stuff, and we also need to train people to be really effective psychotherapists.
And that's interesting you say, because that's been my experience as well, and sort of my thinking about it as well, which is, even the students who do go into research, that many of them, they get into the program because they're interested in counseling, psychotherapy. I mean, maybe assessment, but these very sort of applied, in this counseling psychotherapy world, and that is what I don't know, that, and I think a lot of times students, when there's opportunities to sort of engage in research that's related to psychotherapy, they sort of like light up, because it's like, oh, right, this is why I got into this.
Yeah.
And so I've sort of, that's one of the things that I've thought about too, particularly as some programs become, would sort of self-identify as social justice oriented, that that in the real world, there aren't many jobs for that. And so it becomes, and it's not to say that those programs shouldn't do that. And in a way, it's actually really nice when those programs overtly say, this is what we are, because then people know, right? So people can make good, informed decisions. But that, yeah, I just think about that, like, in terms of why the graduate students are coming here and what they're wanting, and that a lot of it is based around doing psychotherapy.
And for a lot of those programs that I know of, at least, some of the faculty are doing research in communities, and so people can get kind of a, not a specialization, but more of in-depth training with certain communities. Um, and I think that's fantastic. That's great. Like if that's your passion, um, do it and find that program, find that professor or professors who are doing that work, and go train with them. That's your, I mean, in some ways, grad school is really hard, and it's also kind of a selfish time for for trainees, right? You get these 4 or 5 years, maybe 6 years, to like just focus on what you want to learn and learning, and like maybe this is old jaded professor talk, but like I don't get that luxury anymore, right? Like I have to do what I do.
Yeah, totally. I often refer to graduate school as sort of a choose your own adventure.
Yeah.
Um, okay, so there's a couple more questions before you wrap up. So one of the things that you had talked about doing work now with supervision. So just sort of a practical question, what does MCO training look like, or what could it look like?
Yeah, good question. So I think it starts with like if you're a supervisor listening, like it starts with the questions that you're asking. And so one of our studies that we did, Mel Wilcox led this study, and what we did was adapted some of our measures, our MCO measures for supervision, but we specifically asked like, how is your supervisor doing with you and your identities versus asking about your client's identities, right? So like basically trying to differentiate how much are you guys talking about your client's identities and how that relates, and how much are you talking about yourself. And it turns out that supervisors are more comfortable talking about clients' identities and cultures than they are inquiring about their supervisees' identities and cultures, which kind of makes a little bit of sense. It's always easier to talk about people who are not in the room. Uh, and I think that's the hallmark of supervision in some ways. But I do think that uh, there's something to be learned by that, right? And what MCO supervision could look like is really making sure that you are putting as a supervisor, putting yourself out there and understanding how your identities are influencing this supervisee. First off, second, to understand how that interaction is, and then thirdly, in the parallel process way, understand a little bit about how that interaction between you and your supervisee is interfacing with that client, right? And so having that lens and starting with that lens can help understand what the relational dynamic is. And obviously, this is going to look differently based on the supervisee's level of development, and all of that, right? So, like, with if you're seeing your first client and you're trying to process through all of that, that might be a lot to deal with when you're just trying to get through that first session, and make it fluid. But like as it starts to develop, you can start to think about how can you roll some of this in, and how can you start the conversation even from day one about, hey, this is going to be influencing us, even though we might not talk about it super directly at first. This is I'm aware of this. We should be aware of this, and we should be able to name things that are coming up for us, right? Because like even if you think about it, one of the supervisees' major complaints about a supervisor is they don't align on their therapeutic orientation, right? So supervisors suggesting, hey, go do homework assignments or ask the miracle question or blah blah, and the supervisor's like, that I don't like that. But what that's the subtle conversation about that truly is our values are not aligning about how change happens, right? And those values about how change happens is a cultural conversation, because how you believe change happens in this world is culturally based, right? It comes from however you grew up, whatever family you grew up in, however you understand that. And that is a different conversation than just saying, I don't like the miracle question, or I don't like doing empty chair technique. Like there's something about those techniques, those theoretical orientations that are culturally based. And so why is that the case? And that's where I think supervisees and supervisors can align better, is by having the cultural conversation, like where do your beliefs come from about change, and going down that route.
So one of the things I'm hearing you say is to bring it, I always sort of say this, which is like bring it into the room. So for the for the supervisor to bring sort of that process that's occurring into the room there will facilitate training how to do it for how will facilitate the trainee learning how to do it in the room with their client.
Yeah, and what we find is that like their or supervisors who are more culturally humble, for instance, have supervisees who disclose more stuff, right? And that seems simple and that seems obvious for sure. Um, and it's a good reminder that like this is a thing that I've been harping on recently is that like one less than 1% of all sessions that a trainee goes through, unless it's a live supervision model, are ever seen by anybody besides the client. And so if you think about that as a field, and it goes down even like lower after licensure, right? Like I'm guessing close to 0%. Um, and so what we're really doing as a field is that we're training people to talk really well about therapy. We don't necessarily know how well they're doing most of the time, but if they sound really smart in supervision, a supervisor is going to be like, "Oh, that's a great conceptualization." They could have this whole thing, this deep psychodynamic countertransference relationship, and all this other stuff they were talking about. They could have done like this complete psychoed that whole session, right? Like you just don't know unless you watch. And there's some tools out there to help people get a better understanding of psychotherapy now than we had before. But like I do think that when it comes to some of these pieces about disclosure, we really need supervisees to be able and feel comfortable about disclosing their what's happening in the session, and also comfortable enough to say this doesn't fit my values or this is not aligning with how I see the world. And that's a hard thing to say unless you have a really great relationship with your supervisor. And I think supervisors need to figure out what are you really evaluating people on, right? So like in our program, and I think consistent with most programs, supervisors fill out an evaluation. What are they basing that evaluation on? Like, and if you think about it, it's probably maybe 10 minutes of a session every week, if at best, I would say. Um, and so now we're evaluating students on their cultural competencies based on maybe one or two clients sessions that were reviewed, like literally, like think about like the ramifications of that. That's a lot of judgment that we're making on very slim data. So
So, um, sort of towards the end of this here, so what kind of pushback have you gotten? This model, this orientation is sort of it does differ from traditionally sort of how we started at the outset of this, how traditionally we've been taught to deal with culture in psychotherapy. And I'm just kind of curious what the field's reaction, or at least as much as they've told you, what the field's reaction has been.
yeah, I mean, at first, one of the things that we got some feedback on was that it wasn't socially justice focused enough, and it wasn't intended to be. So that's, I mean, mission accomplished, I guess, in some ways. And I can still see how some of the tenets could be used in some of the social justice frameworks that are out there, right? Especially cultural humility. How do you engage communities? How do you approach communities? Like, I think that some of the same principles have been in the literature for a long time. Um, I think the other piece is, we sometimes get feedback that it's not prescriptive enough. And I was like, it can't be prescriptive. So like some of the folks from like the culturally adapted treatments approaches where you take CBT and then you adjust it for a specific cultural group. Those are much more specific in terms of like what to do in session, um, kinda, but not really. Like if you dig deep enough, it's basically cultural opportunities, just written down. um, and I think the other criticism that we've gotten over the years is that we're diluting the competencies. So by not focusing on competencies, that we are somehow making white people comfortable now with culture because this framework. And I and I hear that feedback in a couple different ways. In my mind, I want people to be engaged with this material in any way they can. And um, I used to rail against the competencies movement, but now I'm like, if you're studying multicultural competencies, great, do that. Let's do more studies on this area. Like there's no limitation to how much knowledge that we need to have in this space. I mean, if you think about it, like the Working Alliance and its relationship to therapy outcomes, over 250 studies at this point, that we have in meta-analyses. Multicultural orientation and multicultural competencies, not even in the ballpark of that. And most of that research has been, even a lot of my own, has been like cross-sectional studies or retrospective studies, and very few prospective studies like the Working Alliance literature has. And so, like, we need to get to a space where researchers across the spectrum of psychotherapy are as comfortable as dropping in a cultural humility measure as they are an alliance measure. And I think that's the piece where we need to get to. And if you're studying it from cultural humility lens, if you're studying it from a multicultural competency lens, like we have measures for you. Like that we have them brief. We have these new brief measures. Like it's out there, and I'm willing to share any and all things because I really want to see this field grow. Um, like I don't make money on this stuff. Like it's just I'm willing to give it out, and this is why I'm here with you, Dan, and this is why I love this work.
So to wrap up, you and I were talking just briefly before we started about some of your current stuff that you're doing and what you're excited about, and you were talking about some of your machine learning projects that you're doing. So could you catch me up on that stuff?
Yeah, so we developed after Tim Anderson did his work on facilitative interpersonal skills, which is basically, if you're familiar with this space, it's therapists see a client and they say the client says a brief statement, and then you respond as a therapist, right? So it's all like really micro based training, and so he developed some videos. He did some great studies, and it predicts a lot of good things in therapy outcomes, like as you would imagine, therapists who are better at facilitative interpersonal skills like empathy, warmth, persuasion, alliance building, like those things then predicted their therapy outcomes. And that, so I got inspired by that. And so we developed some videos where people respond to these, again, brief cases, but they're all culturally based. So Tim's original work, all the clients were white. And a lot of the pieces within that, he's now developed some more clips, and there's other groups out there like Skill Setter. If you're familiar with that, I can drop you a link on that. They have a ton of videos, over 1,000 videos I think at this point. So anyway, there's a lot of people using this kind of technology. And so what we did, one of my former students, Dr. Shakira Haywood Stewart, she developed this, and we developed a coding manual. And so we coded like 800 videos, kind of a labor of love. And we validated this assessment tool, and then we sent it over to our friends over at Listen, who's a company that does a lot of machine learning, a lot of cool stuff.
So just sorry to stop you real fast, but you developed an assessment tool that assesses what?
Assesses MCO. So
Oh, multicultural orient. So like in these clips, how much the therapists are applying, manifesting multicultural orientation in their
yeah,
work. Okay.
our three pillars, humility, comfort, opportunities. And then we thought, like, I wonder if machine learning can actually predict this as well. And it turns out the answer is yes. And so a lot of people thought, like, how do you predict something like this? And so it turns out we just published this paper looking at machine learning predicting the MCO framework, and it does pretty well. It's not perfect, right? It's not anywhere close to humans, and this is just one sample. So anybody out there who knows machine learning knows that your models are only as good as the samples that you train the data on. And so we're now currently looking at expanding that. So we developed some new tools and some more videos, got them professionally done. Um, and they look great. we have a whole training module, 5 modules, runs you all through the MCO framework, and you get to practice on these mock clients. And so what we're going to do with that is train some new models for machine learning to see if we can provide in real time feedback to folks to see how well they're doing with MCO. Because as you know, as any educator knows, you don't have enough time to watch every single video, every single response for all your students. It's impossible. So like it's about scalability, and that's what we're shooting for is how can we train people in MCO, provide them real-time feedback based on machine learning models, give them some encouragement, give them some more like async stuff. Um, and it's getting good reception at this point. We're starting to get some more responses on it, and that's kind of where we're going in this next couple of years. That we're going to get this worked up in a place where it's scalable for folks.
So this and tell me if I'm wrong here, but so to sort of summarize here, what you're developing is the idea is a person, a trainee or a professional doing continuing education or something like that. The idea is that they can, log on to some platform, they'll get some training, and then they'll be shown sort of mock video clips of a client sort of saying something having to do with culture or identity. And then based on the training, the idea is then the therapist or whoever's the actual person in this interaction will respond to the video, and then the um, the system, the algorithm, the whatever, will then watch their response and give them feedback within seconds or a couple of minutes. That'll say, "Hey, this is here are your scores on um, cultural opportunities or cultural comfort or whatever." And perhaps even, here's your score based on this response you gave here or that response you gave there. So the idea being it's an automated system so that me as trainee or me as therapist who actually wants to get better at this, I can access this training and actually get feedback on what I'm doing in a convenient way, because I can do it whatever I want, because I'm not reliant on anybody else, but also theoretically on a cost-effective way, because I don't need, Dr. Owen there giving me feedback and he's going to charge $150 an hour because he should. But it's just, so it's all automated. So I can get this training and get feedback on what I'm actually doing and then work to improve what I'm doing through this automated system. Is that a reasonable encapsulation of what it sounds like you're doing?
Yeah, 100%. And we're also developing some videos to show um, MCO focused responses. So right, so getting feedback is one thing, but if you don't know how to change it, that's you can keep going and going and going and be like, what do I need to say? And so we're also providing some model responses as well.
Cool. And so I've thought about this a lot in terms of like in the class that I teach, in terms of training basic skills, that we have a couple of assignments where we go through and actually go through the transcripts and give feedback. But it's similar to what you were saying earlier, where if they have if the student's done 10, 20, 30, 40 hours whatever of practice in this class, and in total we're giving them feedback on we're giving them really good systematic coded feedback on a half an hour of these dozens of hours that they've done. And that it's like, wouldn't it be great to have tools like this, so that way, whether it's just out of their own keenness to get better or as part of assignments, that they could be getting this feedback, and even if it's only kind of 80% right, um, that's hugely helpful, and they can learn a lot from that because they can just get so much more feedback.
Yeah, absolutely. And what we've seen, at least, our prelim kind of findings for like the usability, accessibility, people like it because exactly what you're mentioning. Like they can do it on their own. The feedback, we don't have the feedback yet, built into the system, but like the notion of just practicing, um, and we do an assignment where we practice and share. So like we have partners. So like I always talk about like, do do you have an MCO buddy? Like, and what would that mean? So like what an MCO buddy to me means is somebody who's able to be like giving you the real feedback, right? Because a lot of students, when they give feedback to each other, they're very kind, which is nice, which is very, very nice and very appropriate. And you also need somebody to be like, yo, you didn't say that really well. You're coming across a little arrogant. Like, you need somebody in your space that's able to say that, or like, hey, that sounded a little misogynistic. Like, you need to tone it down. Like, you need somebody in your world that can give you that real feedback. And it's sometimes not always the instructor, right? Because they may not be always seeing, to your point, all those hours of training. And so again, like, this is a tool to kind of help build in an MCO buddy, and that's kind of what we're shooting for.
I mean, I think it's fantastic, and I think that this is such a useful use of this sort of technology, and it's so available now, and it's becoming increasingly accessible to folks. And I mean, it's one of the advantages of being a faculty member in 2024 instead of in 1984, because you can, you've spent, a decade or two sort of really developing with your collaborators this theory that's really, very practical, and so people can have access to it and learn from it in ways other than reading a chapter in an edited book or an article or seeing you in an academic talk. Like, but they can actually, this allows the actual clinician who's working 9 to 5 and who, frankly, they're not going to read the article, they probably don't even have access to the article, that they can actually like learn from the countless hours you and your collaborators have put into this, and actually be like, where the rubber meets the road, they can learn how to apply it in their work with their clients.
Yeah, absolutely. And that's our hope.
Thanks so much for watching. If you found it helpful, please like the video and subscribe to the channel. I'll see you in the next video where we continue exploring the science of psychotherapy and applied psychology.